Prescription drugs, although needed for many people, can cause addictions, which can lead to serious side effects. Pharmacist Carolyn Colson tells us why it's important to take precautions while filling prescription drugs. The big question is, how are these drugs getting into the hands of those addicted?
It has to be prescribed.
Yes.
So it's whether they're going to outpatients who may not have the full story.
Yeah.
Like if they go and they're presenting the right symptoms to the doctor, pain's really subjective, so how do they really know what's going on? And the patient has a history of having pain, well then how do they know any different?
Charlottetown police say the number of prescription drugs on the street went up in 2011 compared to 2010. There are a number of reasons why these drugs end up on the streets.
Run into the people who do have valid pain, they're going to their family doctor, they're bringing in their prescription, they don't have coverage, so they have to pay for it. How are they paying for it? Well, they're selling a few of them. The big, really nice thing right now in Prince Edward Island is we have what's called the Drug Information System, which launched a couple of years ago, where every pharmacy submits your prescription that's held on a database, so I can actually see if they've had that medication before. OD on pain medications, but we generally don't see that. But there is really no limit to pain medication. I think the assessment process is big. I mean, the doctor has to reassess their pain level. There's different formats where you can assess if they are still in a lot of pain, and maybe doing that assessment more often rather than, come back and see me in 6 months. Maybe seeing them more often would be a little bit easier.
Although there isn't a solid solution to what pharmacists and doctors can do on PEI, they are trying their best to prevent prescription drugs from being out on the streets. I'm Laura Warren, Holland College Surveyor, Charlottetown.